All right, let's dive straight into it. We're going to break down the complete legal checklist for teleconsults, covering everything you need to know about consent, jurisdiction, and documentation as a doctor practicing in India.
So, let's start with the basics. What is telemedicine, legally speaking? Well, the 2020 guidelines are pretty clear. It's delivering healthcare using any digital tool. And it's so important to remember this isn't just about video calls. It's audio, it's chats, even emails. If there's a clinical intention, it counts. This broad definition, well, that's the starting point for everything else we're about to cover.
Okay, let's get started with Section 1, the legal foundations. These are the non-negotiables, the things you absolutely have to get right before you even think about starting a teleconsult.
So, who gets to practice telemedicine? The rule here is super simple. Only a registered medical practitioner, an RMP. But, and this is a big but, just being registered isn't enough. You've got to be completely transparent. That means your real name, your registration number, and your qualifications have to be clearly visible. It's kind of like your digital nameplate, right? And don't forget, every single ethical guideline from the NMC that you follow in your clinic, yep, it applies online too.
And this leads us to something absolutely crucial. I mean, if you remember one thing, let it be this. Your duty of care to your patient, it's exactly the same. It doesn't matter if they're in your office or on your screen. The technology might change, but your professional responsibility, that stays exactly the same. Now, the law is very specific about the type of consultation you're having. Is it a first consult? That means it's a new patient, or maybe it's been more than 6 months for the same problem. Or is it a follow-up? That's for an ongoing issue within that 6-month period. Why does this matter so much? Well, it all comes down to what you can and can't prescribe. It's a really important distinction to make. All right, on to Section 2, mastering patient consent. You can think of this as the legal handshake that has to happen before any teleconsultation begins. Without it, you simply can't move forward. So, when it comes to consent, you've got two main types. The first is implied consent. And honestly, this is the one you'll see most often. If a patient calls you or sends you a message or a video request, their action itself implies they agree to the consult. Simple enough, right? But what if you are the one initiating contact? That's when you need explicit consent. This has to be a very clear, documented yes from them before you start. Okay, so how do you properly document that explicit consent? It's basically a 4-point checklist. Step 1, get their clear agreement. Yes, I agree to this teleconsult. Step 2, you have to tell them about the limitations. Be upfront about what you can and can't do remotely. 3, get their permission to collect and share their medical info. And 4, and this one is absolutely non-negotiable, you have to write down the exact time and date you got that consent, every single time. Okay, we've got the foundations, we've got consent covered. So now for the big question, right? What can you actually do in a virtual practice? Let's break that down in Section 3. This table gives a great overview. So look, things like taking a history, counseling, making visual observations, absolutely fine. You can even issue certain medical certificates, provided you're confident you can verify the patient's condition. But there are also clear no-go zones. Anonymous consults are out. You can't prescribe higher-risk drugs like narcotics or Schedule X. And issuing a fitness certificate for a serious condition remotely? No way. The key takeaway here is pretty simple. You've got to know your limits. This brings up a question I hear all the time, and it's a tricky one. What do you do if your patient is in another country? Okay, so here's the deal. The laws of India apply to you because that's where you are practicing from. That part is clear. But the patient is also subject to the laws of their country. And this, my friends, is a huge legal gray area. The guidelines don't fully cover it. So what's the best practice? Honestly, to protect yourself, the safest bet is to avoid giving definitive medical advice or prescriptions to patients outside India. It's just not worth the risk. And that brings us to our final section, and honestly, this might be the most important one for protecting yourself. We're talking about documentation. This is your legal armor in telemedicine. Look, for every single teleconsult, you need meticulous notes. Think of it this way. If it's not documented, it didn't happen. Your notes need to paint the whole picture. Who is the patient? How did you talk? Video, audio, chat? Was consent documented? Then you need the full clinical history, your observations, and be sure to note any limitations of the remote exam. Finally, your provisional diagnosis, the advice you gave, any prescription, and a very clear follow-up plan. This complete record is your absolute best defense. So if we boil all this down to one single idea, what is it? It's this. Telemedicine does not, and I repeat, does not
mean lower responsibility. It's the same high standard of care, the same ethical duty. The only thing that's changed is the medium, and that medium comes with its own set of rules you have to follow.
Your med lawyer, protecting doctors, empowering patients.